Hi, I'm Dr. Rishikesan Kuppusamy. I am a consultant neurologist in Pantai Hospital Kuala Lumpur. While I handle patients with symptoms across general neurology, acute stroke has always been something very passionate to me. So today we'll be talking about stroke and issues pertaining to this topic. Essentially, in a nutshell, it's a condition that happens because of an interruption to blood flow to your brain, sort of like a heart attack. Typically a block, but it could also be a bleed. So let's answer questions related to a stroke and give you some understanding about this topic. Question number 1, how do we prevent a stroke from happening to us? I think what's important to understand is a stroke happens typically because of pre-existing medical conditions which eventually leads to a complication like a stroke. Diabetes, hypertension, cigarette smoking, obesity, high cholesterol or fat levels, high stress, poor physical lifestyle. Now all of this contribute to a stroke. So what we ought to do is to control all these points individually with the help of your doctor, and therefore to keep your risk of these conditions at bay. Are strokes hereditary? This is a very important question because I think many people are scared when you have a dear family member who's been affected with a stroke. Now, this day and age, we would put strokes from an hereditary point of view as one of the rarer forms. This usually affects younger people, but they can be equally devastating. But these hereditary or genetic related strokes are very rare. They tend to present at a young age and often have very poor outlook. But this is a complex topic, and typically younger patients are obviously put on long-term follow-up. Now the next question asks if strokes can be prevented through diet. This is some very unique times because we have many information available for patients regarding diet and supplements. But this is actually not a replacement for medical care. It can supplement what you take with medications, but not replace it. So to answer your question regarding diet, I would say that it will help you indirectly because a good, healthy diet would keep your blood sugars in check, will help to keep your hypertension under control. It will help your blood and medications to keep your cholesterol under better control. And essentially, we would advise you to have diet that's rich in fruits and vegetables, high in fiber, low in saturated fat, with controlled amount of carbohydrates, but as a supplement to medical management, but not as a sole method of preventing a stroke. We'll move on to the next question. Can I prevent a stroke from happening after I experience the symptoms? What's critical for patients to understand is the minute you develop symptoms, any of the symptoms that I mentioned earlier, what's important for you to do to minimize your exposure to a stroke complication is to get urgent medical help. So essentially, 2 million brain cells, or what we call neurons, die every minute of passing time. Your brain would age almost 4 years for every passing 1 hour. There is a golden time frame, and this is between 3 to 4.5 hours, for which you can get urgent medical help in the form of an IV medication to thin this blood clot that's already in your brain. In a special subgroup of patients, we have a window period of up to 6 hours to introduce a guide wire up into the brain and to suck out that clot. And the next question, the question asks, why are more young people having strokes? This is not a problem just in our country. This is a problem that's being seen worldwide. It's not only regarding strokes, it's also regarding heart attacks and even cancers. I think the answer to this will definitely have to come from the current modern lifestyle that we use in our day-to-day life. Patients are developing diabetes at a younger age, hypertension at a younger age. The busy, robust lifestyle takes away the ability to keep these risk factors under control. There's a lot of abuse in terms of lack of sleep and lack of exercise. There's also abuse of alcohol and social drugs. So all of this has brought medical complications that are typically seen in middle age across to a younger generation. So my advice to everyone is, while there's a lot of beauty in life, it's also important that we pay attention to our health. Keeping a regular check with your doctor every once in a way is the ideal thing, because prevention is definitely the best means rather than a cure. This brings our session to a close. I hope this brief video has given you an understanding about how to identify early stroke symptoms, how to address them when it happens, and a brief outlook of how patients are cared for and how they are managed in the long term. Thank you very much for watching.